Welcome to the Bariatric Surgical Unit at Tunbridge Wells Hospital. My name is Mr. Matthias Fehervari and I'm one of the bariatric surgeons. I would like to talk you through the types of bariatric surgery that we offer here at Tunbridge Wells. All of the operations we offer here for weight loss surgery are involved using a method called keyhole or laparoscopic surgery. This method involves making small incisions on the abdominal wall and accessing the abdominal cavity through those. This method has got faster recovery and shorter hospital stay compared to traditional open surgery. First of all, I would like to talk you through a gastric bypass operation. A gastric bypass operation involves creating a small pouch at the top of the stomach by using special surgical staplers. Following that, we divide the intestine and use one end to restore the continuity of the gastrointestinal tract by creating a connection between the pouch and the intestinal end. The other end of the intestine, draining the excluded part of the stomach, is connected into the GI tract further down. As you can see it on the picture, this configuration sort of resembles of the letter Y. Hence this operation also called the Roux-en-Y gastric bypass operation. Another version of the gastric bypass operation, the so-called one anastomosis gastric bypass, also known as the mini gastric bypass, involves again formation of a pouch. However, with this operation, we tend to create a slightly longer but nevertheless narrow pouch. In this instance, the small intestine is not divided. Rather, we use a loop of bowel to restore the continuity of the GI tract by forming a connection between the pouch and the intestinal loop. As you can see on the picture, the excluded or bypass part of the stomach drains through this anastomosis. And finally, I would like to talk to you about the gastric sleeve operation, which is also called the sleeve gastrectomy. During this operation, we remove approximately 70 to 80% of your stomach. We use special surgical staplers to achieve a narrow, sort of banana-shaped new stomach. By reducing the volume of the stomach, you will be able to eat less, which will help you to lose the excess weight. Endoscopic sleeve gastroplasty is a relatively new type of bariatric intervention. This procedure does not involve standard keyhole or laparoscopic surgery, but rather uses a device that we call a flexible endoscope. The flexible endoscope is a small camera that is introduced via the mouth inside the stomach with an equipment at the end of the camera that allows us to place sutures inside. This way, we can reduce the volume of the stomach and slow down its emptying. This means that you will feel full sooner, but also for a longer period of time. So let me introduce you to some of the measures that we can use to evaluate one's post-operative weight loss. Let's begin with excess weight and excess weight loss. Excess weight is the amount of weight that one carries over the ideal body weight. The ideal body weight is determined by the ideal body mass index, which is generally considered to be 25. Body mass index is sort of a proportion of one's height and weight. So let's take the example of Mrs. Brown, who's let's say 1.65 meter tall, and her current weight is 130 kilograms. This gives her a BMI of 47.75 kilogram per square meter. Her ideal body weight would be considered with the ideal BMI, which is 25, which would equal to 68 kilograms. Now her excess weight is the difference of her current weight, which was 130 kilograms, and her ideal weight, which is 68 kilograms, giving us a number of 62 kilograms. Excess weight loss percentage is defined by the percentage of the excess weight that one lost after the operation. So for example, if Mrs. Brown lost 62 kilograms after the operation, her excess weight loss would be considered as 100%. Total weight loss is another way to evaluate one's post-operative weight loss. Total body weight is considered the absolute weight or the highest weight that one had before surgery. Total weight loss is the percentage of total body weight that has lost after the surgery. So for example, in Mrs. Brown's case, when her absolute weight or total body weight was 130 kilograms, if she lost 45 kilograms, her total weight loss percentage would be considered as 35. So how much weight loss can you expect after bariatric surgery? First of all, it's very important to note that weight loss is a very individualized measure and everybody will have different values. It really matters on age, metabolic rate, muscle mass, exercise activity, and a lot of other factors that we are not even aware of. Also, it's very important to note that bariatric surgery has a lot of positive effect beyond weight loss. The values that we are presenting on these slides are approximate values, and it is gathered from data provided by international societies as well as large randomized trials. Most people can expect something in the range of 50 to 70% of excess weight loss, which equals roughly to 25-35% of total weight loss. Success is defined by international societies, and over short term it's considered if the excess weight loss is beyond 60%. And now we know that over long term, which is currently defined as 7 years, that weight loss is a little bit more modest, but nevertheless still very significant, of 50% of excess weight loss. Complications can happen after any surgery, including bariatric surgery. However, the team here in Tunbridge Wells are well prepared to deal with them, and we are going to do everything to prevent them. The most common side effects after bariatric surgery perhaps is nausea and vomiting, and we are going to give you anti-sickness medication during and after the operation. Infection can happen after any operations, and it can affect in various parts of the body. Ulcers and strictures are more specific to bariatric surgery, and should we suspect you have any of them, we are going to investigate you with an endoscopy in the first instance. Blood clots can happen after, again, any surgery, but they are a little bit more common after bariatric surgery, hence we are going to do everything to prevent them. This includes making sure you're well hydrated, asking you to walk around the bed a few hours after the operation, and of course by making sure that you have got appropriate blood thinner medications prescribed. Leakage in the gut can occur after bariatric surgery and usually happens in the connections that we create. Blockage of the gut is something that happens due to adhesions or scar tissues, and rarely due to hernias. Finally, I would like to talk about some of the most common long-term complications. Rapid weight loss can lead to formation of gallstones as well as excess skin, which under the current funding structure of the NHS are not routinely removed. Malnutrition is a very rare complication, and we are going to give you advice on how to take your vitamin and nutritional supplement. However, after surgery, your primary contact to manage your vitamin and nutritional supplements should be your general practitioner, who will be able to help you with those. Psychological issues have been reported after bariatric surgery. However, we will do our utmost to prepare you for this big undertaking. I'd like to take the opportunity to welcome you into our bariatric surgical unit and wish you all the best for your bariatric journey.